Every day, millions of us drink, cook, and bathe with water that contains a chemical most of us never think twice about: fluoride. It's in our tap water, our toothpaste, and even some foods. But why is it there? Is it a miracle of modern dentistry or a hidden risk we've been convinced to ignore? Today, we dive into the science, history, and controversy of fluoride in our drinking water. Let's uncover the truth. Historical background: water fluoridation began in the United States in 1945 in Grand Rapids, Michigan, as an experiment to reduce tooth decay. The idea came from a dentist, Dr. Frederick McKay, who noticed in the early 1900s that some Colorado communities had unusually low rates of dental cavities. The common factor: naturally high fluoride levels in their water. By the 1950s, studies showed that adding small amounts of fluoride to public water supplies, about 0.7 to 1.2 parts per million, could reduce tooth decay by up to 60%. The Centers for Disease Control and Prevention later called fluoridation one of the 20th century's greatest public health achievements. But not everyone was on board. Critics raised concerns about mass medication and potential risks, sparking a debate that continues today. So, how does fluoride work? Fluoride is a naturally occurring mineral, a form of the element fluorine, found in rocks, soil, and water. When you consume fluoride, it integrates into your tooth enamel, forming a stronger compound called fluorapatite. This makes teeth more resistant to acid produced by bacteria, which causes cavities. Studies like those from the American Dental Association show that communities with fluoridated water have 20 to 40% lower rates of tooth decay compared to non-fluoridated areas. The World Health Organization supports fluoridation at optimal levels, citing its effectiveness and low cost. Chemically, fluoride is safe at low concentrations, typically 0.7 parts per million in public water, but the dose matters. Too much fluoride can cause problems, which we'll explore later. Expert perspective. To understand fluoride's role, we spoke with experts. Dr. Sarah Thompson, a pediatric dentist, explains fluoride is a proven tool for preventing cavities, especially in children. It's like a shield for teeth. Meanwhile, Dr. Michael Rivera, a public health researcher, knew fluoridation benefits entire communities, particularly low-income groups with limited access to dental care. But not all experts agree. Toxicologist Dr. Linda Hayes, while low doses are generally safe, we need more research on long-term exposure, especially in vulnerable populations like infants. These differing views highlight the complexity of the fluoride debate. Health risk analysis. What about the risks? At high levels, fluoride can cause dental fluorosis, a cosmetic condition where teeth develop white spots, or, in severe cases, pitting. The CDC reports that about 23% of children in fluoridated areas have mild fluorosis, but severe cases are rare. More concerning are studies suggesting potential links to health issues. A 2019 study in JAMA Pediatrics found a possible association between prenatal fluoride exposure and lower IQ in children, though the study's methodology has been debated. The National Academy of Sciences has reviewed fluoride safety multiple times, concluding that 0.7 parts per million is safe for most people. But critics argue that cumulative exposure from water, toothpaste, and food could pose risks, especially for infants or those with kidney issues. The science isn't settled, and more research is needed. Fluoride has also fueled conspiracy theories. Some claim it's a government plot to control populations or a corporate scheme to dispose of industrial waste. These ideas stem from the 1950s, when fluoridation was linked to Cold War fears of communism. While these claims lack credible evidence, they persist online. For example, A 2023 X post with over 10,000 views falsely claimed fluoride is a neurotoxin at any dose. Scientists refute this, pointing to rigorous safety standards set by agencies like the EPA. Still, distrust in institutions keeps these theories alive. The challenge is separating legitimate concerns from misinformation. So, where does this leave us? Fluoride in drinking water is one of the most studied public health measures. It's reduced tooth decay for millions, but questions about long-term risks and ethical concerns about mass medication persist. The science supports fluoride's benefits at current levels, but ongoing research is crucial to address uncertainties. As viewers, you are left with a choice. Weigh the evidence, question the narratives, and decide for yourself. Check reputable sources like the CDC, WHO, or peer-reviewed studies. The truth lies in the data, not the headlines. What do you think about fluoride? Share your thoughts below and subscribe for more science-driven content.